We're back on this Booze Day with more of today and the many uses of Botox.
That's right. Most of us know, especially one of us, that Botox is the most recognized for its miracle erasing power, but the drug can also be used to treat a lot of other things. Some are FDA approved and some are not.
Today, contributor Dr. Roshni Raj,
You got it, baby.
she is the cutest, is the author of What the Yuck, and we're going to ask her about all these different uses. We've heard about it for sweating.
Yes.
Yes.
And of course, we know the cosmetic aspect of it. What are some of the other things?
Right, so
headaches, migraines.
Exactly. There are a lot of medical uses, not just cosmetic, for Botox. And one of the big ones these days is migraines. You know, migraine sufferers, they often go through so much, it can really affect their life. And sometimes medications don't help, or they don't want to take a pill every day. So Botox is something that some neurologists or headache specialists are using. They actually do, you know, tiny injections in the muscles of the scalp, the forehead, or even the neck. And it is showing some good results for some people.
Stuff, but just real quick, this is what the FDA said. We reached out to them, and they sent us a statement. Healthcare professionals are free to choose medicines for uses not approved by the FDA if they feel such use will benefit a patient's health condition. The FDA approved prescribing information lists warnings and precautions so that prescribers can make informed decisions about treatments for their patients.
So it's okay to get it. It's a doctor's discretion.
I think the bottom line with that is, you know, you have to be a little bit more careful if something's not FDA approved, and make sure whoever you're going to is very trained to use it in that way.
What about the whole sweating issue? Everyone says, oh my gosh, you should just get Botox, it'll make it so much easier. Something about that makes me feel weird, that you're clogging up pores. What are you doing?
Well, you know, you're actually, you're going to affect or paralyze the glands that produce sweat. You know, the nerves that affect those, and you can really get very effective cessation of sweating. And, you know, this is not just a cosmetic issue. You think about sweating, it sounds kind of funny. This can affect people the way they work.
Their personality.
They literally can't even hold a pen sometimes because they're so sweaty.
And then think about what it does to their interpersonal relationships.
Right. Absolutely.
Where does the sweat go if it doesn't come out?
Can it come out another part of your body?
Yeah, so we're only talking about certain parts of your body. Underarms, it's actually FDA approved for that. Some people are also using it in the hands. I would stay away from the face because, again, there are so many other muscles and nerves there that you want to be a little bit careful for.